Here. Clare Maxwell here at Embodied Learning Systems. And I'm super thrilled to have with me today my longtime colleague and friend, Ron Lavine. Welcome, Ron.
Here, glad to be here.
Ron is zooming in from the incredibly intelligent village of Princeton, New Jersey, where he lives and practices, as well as New York.
Yeah,
And Ron is,
we're more full of ourselves than you are.
yeah, which is like we need that here in New York. So although Brooklyn's a different story.
Pretty full of
So
itself too. Okay.
yeah. And I was thinking back, Ron, I think you and I have known each other since maybe 1983 or 84.
Wow, that's possible.
Is that 40 years?
Afraid so.
Yeah. So, but before I tell you why I'm such a huge fan of Ron, and really he's Dr. Ron Lavine, chiropractor, but a chiropractor is kind of like a label in our embodiment world that can be interpreted in a lot of ways. And to me, I think of Ron more as an embodiment innovator. You got your chiropractic in 1981?
1980, actually, yes.
80, 81. To me, Dr. Ron, I like to call you Dr. Ron to other people, is a really kind, intelligent partner who will always go into incredibly geeky detail with me about what my issues are, will always listen, and has a really open mind. But I think of you, Ron, as like an innovator, because not only do you know the boxes, but then because of that, you also roam outside them a lot while being, knowledgeable. So I really appreciate that about you. You're a pioneer in the use of neurotactile therapy, which I hope we get to hear a little bit about, which was innovated by Irmgard Bartenieff. Is that correct? There are other routes as well.
Well, I learned it from her, but she learned it from somebody else, and so on and so forth.
In Germany, right? It came from Germany.
Well, actually, she learned it in physical therapy school in New York, by the way, although she's from Germany and technique is from Germany.
Oh, interesting.
Yeah.
Well, so if there's any geeks that want to know more about neurotactile therapy, you would be a great person to talk to about. And it's been one of my favorite things to do. So that's one thing. Ron's also a registered movement therapist with ISMETA, the International Somatic Movement Education and Therapy Association. Right. He's a human movement specialist with an extensive background in modern dance, ballet, yoga, Pilates, Bartenieff fundamentals, Alexander technique, which we do trade sometimes, and many other ways of looking at movement. Ron, you've also, you're a chiropractor, so back pain is probably a long inquiry of yours. And I know you've been treating herniated discs and sciatica in different ways for a long time. And now you're a functional medicine practitioner since 2020. Is there anything I'm leaving out? Oh,
so
we're not done yet. What? Oh, so much. Well, I want to hear about the dance, but Ron has also served as a board member on the New York Academy of Traumatic Brain Injury and done some deeper work through that volunteering about concerning concussion and healing from concussion. Mm-hmm. You wrote a book about how to live with
spondylolisthesis? Yeah.
Yes.
Like an ebook, I suppose.
An ebook, which you can find on his website. And he's written a lot of articles on different aspects of his work. He's also taught. So you've taught a number of people how to do craniosacral, neurotactile
therapy, also known as Bindegewebsmassage. Yes.
And therapeutic exercise?
I work on, which is probably what we're going to be talking about the most today, kind of like a posture-based rehab exercise. Yes.
Right, right. Our interest that we wanted to share
Right.
on the channel is about why posture is an important part of rehabilitation. And so it sounds like there's a whole field that I don't even know about that also agrees with us on that.
Yes.
Yeah, awesome. He's lectured at Einstein Medical College. He's been a professor at the Pacific College of Oriental Medicine, teaching sports pathology and neuroanatomy. So what can I say? Way more than a chiropractor. That's all I can say.
Thank you.
Yeah. So anything I'm missing?
I'm sure there's some, I'm just exemplary in so many different ways, and it's so
You
hard to
are.
enumerate, but you covered enough of it.
You get the idea, right? And so, but the one thing also that is that you've been in practice for so long. You've been working with individual human beings.
Trying to learn, learn something new every day, or at least every month.
Right. Well, it's pretty hard to work with humans, right?
And not learn something.
Yeah.
Yeah.
Yeah. So what I wanted to find out a little bit, just kind of for fun, but also to get to know you a little better, is where was the embodiment geek born? Like, when did
That
you
is
start to get
that is such a
interested in
good
these things?
question.
Yeah.
Because the more, if I were to think about it, I keep going back, in the past, and there were signs, all along from infancy, as there, every kid or every person is embodied, whether they know it or not. Idiots. So, but certainly a big moment for me was, so when I first went to college, I took quote African dance class.
Mm.
They're like Afro-Cuban. I don't know what it would be called now, since Africa is a big continent and there's no such African dance. The politically incorrect old days, and there were live drummers. It was the first time I ever understood the importance of that you could learn something about how to move, and that it wasn't about like strengthening your muscles. It was like brain coordination. It starts with your brain. And so it's pretty much been downhill since then. So you could say that's how it started.
That's how it started. And yeah, the drums, the live music,
Yeah.
it really does something to you, right?
Yeah.
Yeah.
Just opened up a world of, it was sort of like, you could say it was fun, but it was engaging. And also I realized like that it was important. That it's really, movement is the most important thing there is. I mean, we know that.
How in your young college self, how did that impact get made? Why did you think, oh, this is important to me? Do you remember? Because
I
you started
remember
dancing. You were a professional dancer for a little while, right? You started dancing.
yeah, we could put professional in quotes, but yes, I took it quite seriously and I considered myself a professional dancer. Yes, I took class, I rehearsed, I choreographed a little bit. Yes. Uh, well, if you give yourself over to a process of movement learning, I think to me it's like obvious that you're going to understand it's the most important thing. So duh. But so I can't say why. I don't know. Am I
Yeah.
cursed? No, am I blessed?
I don't know. For me, it happened when I was 9.
Okay.
And I think it was a similar experience of understanding that I, as a human, came together in ways I hadn't known was possible experientially,
Hmm.
in the music, in the dance, in the group, in going across the floor, in that spontaneous moment of giving yourself over to momentum and sound and rhythm and the sort of present momentness of the experience. It did something for me and for my intelligence. It just engaged my whole self.
Hmm.
I'm sure I'd be diagnosed with something today, but ADHD or whatever. But to me, it's a certain kind of intelligence that it's like it organizes you.
That's wonderful. That's a good way to put it. Okay, I'll go with that.
Yeah. So what was your favorite dance performance or
That I was
experience?
in.
Yeah, it could have been a class or just like, what was your favorite?
Well, in San Francisco, I studied with Ed Mock. He was also, I guess he called it jazz. Do you know Ed Mock, or do you know who
I
he
know
is?
the name. I remember the name because I grew up there.
Oh, no fooling. And it was just
Yeah.
really lively. I
Hmm.
don't know what else to say. There was like a lot of energy, and it was just, a lot of flow. And then that was a favorite class.
I'm
Uh,
going to have to look him up because
yeah, I should too, see whatever happened to him.
jazz dance was kind of a different thing back then. And I loved jazz dance. We had it at my kiddie dance studio. But I don't know what the roots of that particular.
Well, I think he called it jazz, but there was certainly some element of Afro-Caribbean in it as well, as opposed to like Broadway. Yeah, it was more Afro-Caribbean jazz than Broadway jazz.
That's your root. That's your root.
I
It's the
guess so. But
Afro-Caribbean.
I also studied Cunningham technique with Margaret Jenkins. And that
Oh,
was, I guess I liked it because it was very intellectual, you could say. It wasn't, in hindsight, the body learning pedagogy wasn't so great because it was like the arms can go to the side, the arm can go, it was like
huh, huh.
geometric. It
Yes,
wasn't
abstract.
abstract. Yeah, it wasn't like a Limon class that somehow it sprung from some movement, desire or experience or something like that. So it was
Yes.
interesting, and it was sort of artistically, it was like the thing to be into back then, like this sort of abstraction and in movement, or at least it was the thing I got into. Art.
Yes. Well, and it was coming into its own in terms of the
Yeah,
culture and
and in a way, it was already
funding.
by the time I came around, it was already past its prime, really, because
Oh, interesting. Yeah.
there-
I studied with Margaret Jenkins as a teenager. So
no fooling. So you know who I'm talking about.
yeah,
There
yeah,
you
we
go.
went over there. That was the penultimate thing we could do in the Bay Area was go to the Jenkins studio. Yeah. Well, okay, so that gives you a little bit of an idea, dear
Maybe we were in
audience.
class together one time, huh?
We might have been, but I left in 80, the summer of 80. So that would have been like 79, 80 that we were over
No,
there.
I was no longer there.
Yeah. So yeah, so you and I have been in dialogue recently because I had a
Yes.
hip replacement and you helped me
Oh, great.
and you helped me see things. Well, so some of the aspects of what Ron does, like the neurotactile work and some of the soft tissue work with the intelligence of human hand palpation that can gather information, so different than an X-ray machine,
Right.
because my one operated leg was shorter. So Ron helped me with the soft tissue work to release some of the old habits and some of the trauma, literally from the operation, which I think is pretty intense what they do.
Mm.
Um, and then we got into some discussions about posture, which is our topic for today. And I feel kind of like Ron, when we talk about posture, we both end up letting go a little bit of what we think and we start swimming in this kind of weird, like, I don't know. So let's talk about posture and why it's important. And share that with our audience because I think that idea, the reason that posture is important is about the coordination of your mind, your spirit, and your body, and how to bring that into the most lively, healthy place. And from hearing your story, Ron isn't just somebody who's trying to line your bones up. He's kind of trying to help you get your brain
Brain connected.
into the brain connected. Yeah. So tell us how you see what posture is and what good posture is and what bad posture is. And then maybe at the end, we can do a little bit of a exercise or experiment.
So thank you. So I'm a little reluctant to use the word posture because it does have a static connotation.
Mm.
So I think, a better way to talk about what I'm interested in is posture and pattern of body use. And I think there are things that I'm going to take for granted that we all understand. And one of
Mm.
the things, so I don't even have to say them, but I will anyway, just to make sure we know that we all understand them. So one is that motor behavior is largely dependent on all these like preset schema. Like perhaps you have this big idea, or we'll call it volitional idea, although I question even what that means. But let's say you choose to create a movement, the brain then sends that out and organizes it around all these already prepackaged subroutines. So that means if you can change the subroutines, you can change how you move. That's one thing we all know and we all take for granted. That's somatonauts.
So because every movement is composed of so many different subroutines,
Right,
and so many, like if I'm going to decide to go like this,
right,
there's no part of my body that wasn't activated in that movement. I mean,
right,
it's every bone, every segment is
right.
involved, every system.
Yep.
Okay, so you can go in and alter subroutines,
Yes.
and that will change how all the things fit together.
The effective, yeah.
Okay.
So one principle. Second principle that's related to that is there are these prepackaged motor schema, but it also depends upon ongoing proprioceptive feedback. So you're making adjustments and you're making adjustments along the way. And what's interesting about the proprioceptive feedback process is that human perceptual systems in general, including the proprioceptive system, aren't designed to take in the world. They're designed to take in differences between our preset expectation of what we're going to experience and what we're actually experiencing. So that's why, like the visual system, it's much more effective at seeing movement in the distance than it is static, because movement's a change in the background. And the same is true for the proprioceptive system. So that means that the more you can hone or perfect your proprioceptive pre-existing expectations, that will also change and improve your movement behavior.
Oh, interesting. So,
Alexander technique 101, or at least one of the ways I think about what Alexander technique does.
well,
Maybe,
that's so
maybe I'm
interesting because
oversimplifying.
I always felt that my Alexander technique addiction was part of my looking for new experiences,
Yeah,
slightly easier or interesting or fresh in my experience, as well as hopefully the audience's experience or whatever, as
yeah.
an artist. But I guess you can't have a fresh experience if you don't have presets to
Okay, yeah.
measure
Yeah,
it against,
yes, yes.
which is which is what you're saying. That's what we're doing all the time.
Yeah, because that dance performance that feels fresh and new, it's still made up of these different motor preset schema,
Right.
with modifications and with different combinations. But you're not like, your brain is not individually thinking about every single thing that you're doing all at the same time.
It's not possible.
There's too much there's a lot of automation going on. So that's the second thing that we all know. A third thing we all know is the sort of tensegrity structural model of the body, where it's the tension members or the connective tissues or the fascia is important, not just bones in the joints. So, you read a book about movement and it's like the muscles move the bony levers at these joints around these constraints. Each joint has different kind of physiological constraint, and that's what movement is. So the bicep muscle, which attaches to the forearm, it changes the angle of the elbow joint. That is true. I mean, I wouldn't say it isn't true. It's one way to think about it. But another way to think about it is that the muscles change the tensional factors of different connective tissues, and everything flows from that. So that's like the tensegrity model of human movement. We all know that.
We've heard it. There's some folks in my field that are saying it's a very complex discussion for another day, but that there are very important reasons why our bodies don't match up with what tensegrity means in its original architectural meaning of the external structure being the space being held empty on the inside by tension on the external structure. But that's a whole nother discussion.
Okay.
That
Well, yeah, I'm
I
not
still
saying
think,
that's. Go
yeah,
ahead.
I still think, I mean, you know, and look in reading a little bit into your website, there's so much about how the mind is in the fascia, how important the sensory feedback is from the fascia, which is
Yes.
really what you're talking about. And that
Yes.
interests me more than intellectual abstract arguments about tensegrity.
Great.
Physics. It's
Yes.
physics, which
Yes.
is
Yes.
not what that I don't,
Well, it's just a different way to think about it. It's not like the righter way it's just another.
yeah. But so you were really getting into it because of the neurotactile or the feedback and the importance of that in organizing yourself, I think.
And you can't understand human structure without accounting for, tension members,
Right.
anatomical structures that resist stretch.
Right.
And another thing we all know is, what they might call in neuroscience, the model of embodied cognition, which is another way of saying it's not like the brain is all powerful and it just tells the body what to
What
do.
to do.
The decision-making process and the calculations are already embedded in every layer, like the muscle's already making calculations on its own. Or an individual muscle cell within a muscle belly is already making decisions on its own about what to do. And then it's embedded in the muscle, which is making decisions on its level. And then there's the spinal segment, like all the muscles innervated from the same, region of the spine, and so on and so forth, up different layers of hierarchy. But one layer of hierarchy is not the master of the others. So thinking is already embedded or embodied cognition. So that's what, and then I guess the other thing
Preach.
is
Preach.
this is all really important.
This
That's
is
where we
all really
started.
important.
That's where
Yeah.
we all know this is important.
Yeah, we all know this. Well, but I mean, I think we're assuming that a lot of people might know these things, but I think there are different ideas out there. And in the general rehab world, if you go to a physical therapy in a hospital or some other, people might know this, but they're not going to talk to you about it. And so the
Right.
public doesn't necessarily
Know about this.
know about
Or
it.
they don't think about it this way. They don't think about it along these lines. Correct.
Yeah,
Right.
and I think that thinking about it along these lines will help you benefit so much more.
I like to think about it. Yeah, I like to
And
talk about it.
yeah, you like to educate and engage a person in the understanding where they're at their place where they're at with the interventions you're making and the exercises that you give. And
Yeah.
So what's good posture?
So I've been thinking about this too. So posture. And what I've been thinking is there's actually different purposes of posture. So, or there's different purposes of a pattern of body use. One purpose might be like energy efficiency. One purpose might be kind of communicative, expressive, identifying yourself with a particular social group or social class. One purpose might be minimizing the wear and tear on your joints, so long term you don't get arthritis. And one purpose might be to be as a preparation, like you're in a you're in a prepared state, ready for action, or ready, if you're in action, you're ready to shift to a different action. So like a readiness, activated posture.
Mm-hmm.
So how good or bad posture is depends upon how well depending upon which of those goals or what mix of those goals is important at the moment. So in my own
Well,
practice,
so let's just stop and acknowledge how amazing and complex that is, and
yeah,
that we're so neuromuscularly adaptable that we can learn to switch
yeah, it's like code switching. Yeah,
when we need.
yeah,
There are aspects of our expression that are below the level of like involuntary expression. I've
hmm
learned that from looking at the voluntary and involuntary musculature, like our face, for instance,
hmm
has a lot of involuntary fibers. So it expresses before, we can make it do things, but it also does things on its own. And I
and
guess we can make a decision about whether we're going to make it do something or whether we're going to just let it be.
and
That's
you can
just
also,
incredible.
you can also read the changes in another person's face so fast. It's like way quicker than you can think about it. You know, if
Right.
that person is friend or foe, you know, if that person is of an equal or higher or lower status, you know, a lot of things, and you know them in like about half a second
Yeah.
or maybe even quicker.
So
I looked up the
this
data.
is this is thank God we can't control it all, because we'd be insane. I actually looked up. I was kind of curious as to what's the difference between posture and balance.
That's an interesting question.
And I looked, well, because in my field, what I've heard is that the way scientists study the whole system that you're talking about is that there's kind of separate systems for posture, a separate system for movement, and a separate system for balance,
Mhm.
and that those things are studied separately by scientists. But of course, they all interrelate, right? So a good posture for somebody with dystonia is going to be really different. Like a
That's a good
person with
point, too.
dystonia still has posture.
That's a good point.
They just have to adapt
Their own
differently
situation, right?
to their own situation. And that's what you're talking about. You're talking about educating people about the adaptability of their system, finding out what they need to be able to adapt to, and helping them do that.
Yeah, but no,
Yes?
I'm also very prescriptive or directive, like way more than an Alexander technique teacher typically would be, in
Right.
terms of, at least in terms of showing them or demonstrating and helping them to understand like the sort of basis of activated or action posture. Because I think that's important. And I think that most people have the wrong idea about what that is. So I
Most
do
people have
work
the
with them.
wrong idea about what activated posture is.
Yeah.
Dynamic, you mean dynamic posture as opposed to static posture?
Or you could be just standing still, but you're prepared for movement.
Ready, the readiness that you were talking about.
Yes.
So what is it that people get wrong, you think?
Uh, I think I think the main thing people get wrong is that they plant their pelvis too far forward and their rib cage too far back, to put it simply.
Yes,
Yes, what? You agree or
I
you?
agree. We don't always agree, do we? But on this one, I think I would say you see different things.
Yeah,
And you can use your hands to find out what's actually going on. But that's a very common
I think
postural
so. And
concept.
I have to say that if you stand that way, it may require less energy.
Right,
So
it could be
it
more
might be
efficient.
more energy efficient,
Right,
but
right.
you're
So,
less prepared for action and you're also putting long-term stress on your joints and connective tissues, I think.
right, right. That's why people like it, because there's a kind of a relaxed feeling to it.
I guess so. I guess that's
There
why they
can be.
it's
I'll
hard to know.
just demonstrate. I'll just demonstrate.
Oh
Okay.
yeah, okay, great.
So you're talking about, this would be subtle form.
Yeah. And there's subtler
And then,
versions of the same thing.
yeah. it
And
could
there's
be
even like
more,
a
it could
pulled
be
up
more like that too.
yeah, and there's even like a pulled up, stand up straight. Yeah, like that. Like the
There's a
pulled
lot of
up
different
version of it.
variations. Yeah.
Right, right.
And
All,
then, yeah,
yeah, all bad, all
all
evil.
that.
Right,
And your postural system is working there because if your pelvis is so heavy, if your pelvis is forward, well, something has to go back or you'd fall over,
right. It's your rib, and it's
right?
your rib cage. Right,
I mean,
right.
yeah, yeah. So, so your posture is still working there. It's working to keep you upright,
Absolutely.
but it's in a shitty way,
Well,
or
now,
a way that
now
could
we're being
be,
judgmental the way
oh,
that I
Ron,
am, the way that I like to be.
yeah.
But probably the less the way that Alex, or my idea about what an Alexander technique teacher does, which is less judgmental, but they're just opening up the person's awareness about what's going on, because that person is like oblivious to what it really, what standing up straight really is.
Well, actually, that's part of why you could say that we try to suspend judgment.
Mm-hmm.
But part of that is because the person's sense of judgment has been disturbed such that that posture feels right. That's their preset.
Yeah, yeah.
And when you take them out of that preset, it feels wrong and they freak out,
Right,
or they feel
right.
weird. So there's a certain suspension of judgment that's necessary
Right.
for the person to allow something different to happen.
That's a good way to put it.
So that would be a finer
That'd
tune.
or the way I would put it, similar to that, would be, is it good posture or bad posture? Well, before you get to good or bad, there's differentiated or undifferentiated. Like if you don't know where you're at, there's no such thing as good or bad. It's just like that you're just a blob. Once you start,
Neurologically, you're a blob.
right. So once you start to allow for subtleties one way or the other, then you can start to judge, I guess presumably for yourself rather than from your chiropractor, what really works or not.
Yeah.
Right.
Yeah.
So that's the one main, if you want to call it postural issue, that I almost always make it a point to address, because it's fundamental to so many other problems.
Right. And here's what's mind blowing. So when I saw Ron recently, because I'd been living for 20 years with a little bit of cartilage missing in my hip joint, and that cartilage was missing in the front of my hip joint. So if this is your hip joint, it was missing here. Even though I had been managing my tendency to do this, I still had a habit of trying to pull off that part of my hip joint, even though there wasn't any pain anymore. And I needed outside support from Ron and some strengthening exercises to get back up over my femur, and I was like, that feels so weird. So just because I'm an Alexander teacher doesn't mean I get a pass on
Right.
these things, And I needed a little bit more targeted diagnostic, what did you call it? Judgmental information to get some clarity. Like I needed somebody that wasn't me. So thanks, Ron. So I think you had told me these three kind of main topics or subtopics of posture, and getting up over your femur was one of them.
Right. So now we're talking about,
if you want to get into some of those topics now, because it's kind of like a natural flow.
Yeah, because so far we've talked about, well, like bilateral standing on two legs. But what's also interesting is, how does the body shift the weight over to one side, which happens all the time, every time you take a step, or when you're just hanging up.
And you've written about pain in gait, right? Pain in walking.
Pain in walking, yeah. Which, again, in an oversimplified one-dimensional view, what I hammer on there is what's proper weight shift. How does the body, like we were just looking at how the body, like the weight of the pelvis and the weight of the rib cage stack vertically. So when you're on one leg, how does the weight of the body balance over the femur head? How do the rotator muscles control the alignment of the trunk over the leg? So how does the body adapt to that? Should I do like a little
So
demo?
when Ron says rotator muscles, tell us, Ron, what rotator muscles are.
Okay, so the rotator muscles are muscles that are one attachment is on the pelvis, and the other attachment would be on the femur. The main one, so we can call them all for shorthand by the one name of the piriformis. It arises from the front surface of the sacrum and inserts in the greater trochanter of the hip. So it's if the pelvis.
So when you say front,
stable,
you mean if you were looking at somebody from the front,
from the
you
front,
were
it would be
looking at what we
inside
might call the
surface,
inside of their
inside of
sacrum.
right,
Yeah, so that's like a really interesting from inside the body to outside. It's
the
interesting
outside.
angle. Yeah.
And it would externally rotate the thigh if the pelvis was stable. But when we're standing, it's not like the pelvis is stable and the thigh is moving, it's the other way around. So it controls the alignment of the pelvis and the trunk as a whole over the femur head.
So this is one of the places where in my way of working, I just don't think about one muscle controlling anything.
Right.
And yet, when I work with Ron and he'll give me an exercise, it's so great to have this one motion to be given to go, oh, because there is an activation of that one muscle that you need to, that you may not be doing. It might be a little sleepy, you know?
Yeah, I don't really think about it as one muscle that's activated.
I'm sure, I know you don't either.
Because it's like we're talking about like postural based rehab. So it's not like strengthen your glutes.
Right.
It's like understand. Should I do a little demo here? Or yeah. Okay. So you're gonna hold on to the ballet bar there or the wall. And you're gonna stand on your right leg. Okay, so now we notice that the weight of her pelvis shifted to the right when she did that. Okay, so and what happens there is that the muscles on the outer thigh and the iliotibial band, yeah, support the weight, but through tension. And I don't think of I'm not thinking of tension as like a negative thing, like you're just being tense. It's just like that's the mechanical force that those tissues resist. But instead of shifting the weight that way, now if you shift to the right, but then pull up over your right side, so lift up your left leg, now pull up over your right leg. There you go. Yeah, so there's much less of a lateral shift. And then the weight of the trunk is balanced more over the femur head as opposed to having to be carried by tension in the outer thigh area. Go back to the old you. Yep, that's a really clear distinction. So the old you, you're going to put a strain. This is one thing I'm interested in. You're going to put a strain around the trochanter area, and it's going to lead to trochanteric pain syndrome or gluteus medius bursitis or piriformis pain, or else it's going to lead to iliotibial band friction syndrome because you're also putting a tension stress through the whole iliotibial tract down the outer thigh. So this is so when I work with people with this, I don't tell them strengthen your piriformis muscle. I say feel that line, pull up over the leg, feel that line more vertical and minimize the lateral shift. And then all the muscles that have to do that sort of automatically come into play.
Yeah, so my experience of that was there was a lot less distortion in my upper body. And I had to really use the muscles. I had to tense up the muscles on the outside of my standing leg. But it felt a lot more like a good place to move from. It felt more stable. But yeah.
So yeah, so you've just described the differences between like active stance versus a more passive stance, which may have the advantage of using less energy. But you're less prepared for movement, and you're also putting different stresses through the connective tissues of the body, leading to overuse injuries and tightness and all this other kind of stuff.
Right.
So very exactly what you just said.
Right. So So you've got forwards and backwards potential in terms of balance, standing balance. You've got side to side. How do you think about rotation?
That's a good question. I don't think about it that much, I guess. Although lately I have started to think about, like, okay, like if I'm having an Alexander lesson with Clare Maxwell, I'm walking across the room. Part of my experience is I'm sort of letting my head be free and easy, sort of floating above it all, and letting everything else kind of just go with the flow beneath that. And then I get like my arm swing is just sort of more natural. And that's segueing more natural into like a trunk rotation. So I certainly recognize its importance. I'd have to think about it. And then I give rehab exercises specifically to, work with rotation and stabilization of the trunk in rotation and all this other kind of good stuff. But I have to think about more, I kind of like weave it into like a coherent system.
Well, no, even just that is very interesting, because I know many students will say in my Alexander practice, the first movement that feels better to them and the movement where they're able to start applying the things they're learning is in walking.
That's interesting.
And I think it's really interesting because not fixing the legs over the pelvis has been like a pet peeve of mine for many years, that when we fix the pelvis, now I don't mean stabilize, but when we, as dancers, we learn to hold our pelvis square over our legs in a certain way.
Right.
And that caused so much damage and injury and really did not facilitate healthy movement or free movement either. So in walking, what's coming to me now from having just done your exercise is that it's not that the lateral shift isn't happening in walking, because it is.
It is.
But there's there must be a rotational aspect to it, such that if I was to personify your piriformis, like if this is my femoral head, the trochanter, and this is the inside of my sacrum, it'd be like contract. Yeah. There'd be like a milking of the cow kind of thing going on down there.
Yeah, that's interesting. I have to think about that. I like that.
Subtle. There'd be a subtle, it wouldn't be just like both of your piriformises like the whole time. There'd be like a rhythmic,
right,
engaging, releasing that is healthy, I think, for muscles to engage and release. I'm sorry to say it, but it's making me think of a stripper I saw once that could do that with the butt muscles, alternating the butt muscles. But anyway. Yeah, so how is this different than what traditional, this kind of, even just this way of looking at overall human movement and making sure that a person understands something cognitively about the change that they've made and what they're trying to do, the engagement of, I mean, I'm not saying that doesn't happen in physical therapy, because it does. But how does this postural element change overall treatment and outcomes for people in your experience?
Well, that's a good question, because sadly, I don't have the outcomes research data to show how much more brilliant this approach would be.
Right, because it's hard to study.
It's hard to study. And it's hard to study with a limited, I mean, every different people walk into my office. I don't have a cohesive, I don't have a homogeneous group of people I can like run tests on ever. Yeah, so it's hard to study. So I just like to think it's better because it's more truthful. It's more based on the way the body actually works. So I just have faith that because it's based on the way the body actually and the brain actually work, that it's going to be better, but I don't really know.
Well, so I only know from this recent experience that both of my physical therapy experience and my experience with you, and I also went to visit George as well. The difference was that you addressed my deepest core challenges. What the PT did was give me the strength I needed.
Right, right.
Which I had lost and in some cases never had, because the pain had been there for so long that my brain had taken a bunch of stuff offline. And I just needed repetitive exercise that was somewhat unpleasant and slightly scary to do. And I needed somebody to give me clear guidance. And I got that from PT. And I got the knowledge, and I got the what to do for myself. But when I said to them, my legs are different lengths, can you help me problem solve this? Or what am I going to do about that? They were just at a point where they would accept the structure.
Well, there is something to be said for that too.
And there is something to be said for that. But
topic, right.
The work that I did with you, the manual work,
Right.
and as you and I discussed, what a chiropractor can do is exert specific forces in specific directions on a person's body that I could not do for myself.
Right.
That changed how joints were relating to each other. I think I got maybe, another quarter of an inch less difference between the two legs.
That's excellent.
So there was change possible, and in their framework, they don't know about that so much.
There's that changing structure, but I'll give you another example of a difference. Everybody's different. There's good and bad. I'm going to see if I can angle this down. And she would stand up from a chair and she would go like this. Right? So there's no like control of knee alignment as she's standing up from a chair. So the physical the trainer in the gym says, well, you need to strengthen your piriformis and your glutes, and gave her all these exercises for the piriformis and the glutes in a non-weight bearing, non-functional mode. Now that's good. I give people those exercises too. Right. But why not start your rehab with plie, which is part of the getting out of a chair, but it's an easier version, and really have the person focus on their knee alignment as they do it.
Yeah.
And build it up sequentially from there. She has enough strength in her muscles to control the alignment. She just doesn't connect her brain in a way where that would make it work.
Right.
So that's I guess the difference. Or that's how I work.
Yeah, you're linking it up functionally.
That's what I'm trying to do. Right.
Yeah. Yeah. I mean, that's another great example, because the PT gave me squats, which I couldn't do. Even one squat was terrifying at first. Now, it could be that I had good alignment, and so he just didn't address it. But there was no concern
over your alignment.
Right. Over the alignment.
And
it was just like, great. If she can squat, we want her to be able to squat. Right.
That's a great exercise.
There's something great about that. So I guess what I mean to say is that there's not always a need for refinement at a deeper neurological level.
Yeah,
like
I suppose
sometimes we just need to be human and who we are. You can only change so much in 10 weeks or whatever you have at the PT. And that's actually good. People deserve that kind of care. It's good care. It's funny because the way they treated me was that I had special needs because I'm a dancer or because I teach. So they were willing to answer these weird questions.
That's great. But on the other hand, like for other people who are like normal, They don't get as good quality of care, sort of.
Yeah, or education, you could say. They don't get,
Education, right.
and we're calling this connection of my cognitive, and overall coordination of body and understanding what's the function of what I'm practicing. Why am I practicing that? What is it going to help me do? So,
Interesting.
yeah, I mean, I think we're all doing the best that we can, given the limitations of the systems we were trained in and the ways that we can work with people,
Oh, absolutely. Yeah. Oh, absolutely.
you don't have a supervisor looking over your shoulder to, so is there anything else you want to say about the sort of hip joint and your, lifelong sort of investigation of this, of good posture? And, you were talking about, what do you call it? The vertical load and lateral shift. So how do we manage vertical load?
We
and
manage
how do
vertical compression, because I took up running in the last 5 or 6 years.
talk about vertical load, right?
Yeah, so there's vertical, but there's also lateral shift load.
Right.
Right. So the two things in running are, how do you manage vertical loading and lateral shift? If you can figure that out, if your body can figure that out, then you can run effectively and, reasonably injury free. Although I have to say my knee is still screwed up a little bit here.
Still a little funky. Yeah.
But,
so then we're vulnerable as practitioners. We are also vulnerable humans.
Yeah.
Okay. Yeah. Well, so, if what you and I did was part of the healthcare system, or better known and more accessible to people, how do you think the world would be different?
Well, for starters, Donald Trump would not be president.
Right.
And right off the bat, things
right off the bat.
I need say no more.
Yeah.
If I want to be grandiose, embodiment and self-awareness is all part of like being in touch with reality. And
proprioception at a larger level, like
well,
being able to feel what's happening,
and recognize something that's true from something that isn't true. Because ultimately our body level experience is the only thing that we know of to be true. Everything else, somebody else told us. Does that make sense?
Yeah.
Right.
And I guess my lifelong exploration has been using my whole body to investigate, well, is that really
right?
How true is that?
Right. Like, I know that E equals MC squared, but like,
do I feel that?
You're right. And I'm not saying that's some obscure thing. It's fundamental to the way the universe works. It's important. But I only know it because somebody told me that it would, that's how the universe worked.
Right. So the profound effect of a deeper engagement with one's embodiment,
The deeper connection with the reality and truth.
With reality, with truth, and with your body as this incredibly finely tuned instrument that can, maybe not give you ultimate truth, but help you respond more wisely to what is going on around you and in you. And
yeah, because you bring up an interesting point, because responding, a lot of human existence or human evolution is driven by social networks.
right.
So a lot of what we're responding to in the environment are social cues, like facial expression among them.
And posture. And expression.
Exactly. Thank you.
Of movement.
So we would be doing a better job with that if we had, better body awareness, better self-awareness.
Yeah. Well, that's a great note to end on.
Now that we've solved all the world's problems, right?
Well, of course, we tend to think that what we know is the solution, right? But actually, all we're saying is it helps us communicate more clearly to find the solution, which would pull in everything. We're just saying, hey, this piece is really important, And people really long for it. If they can get it, they would. If they could access it, they would, I believe.
I
So
believe.
this channel is all about making it as accessible as possible. And you've been of great service today. And I'm
Good
so
job.
grateful for your
Thank
friendship.
you. Thanks for having the conversation.
Thanks, Ron. And if you want to find Ron, his website is in the description box below. AskDrLavine.com.
Yes.
Lots of great articles. You can buy the book about
Spondylolisthesis.
and just a lot of wisdom there. Thanks, Ron. Have a beautiful day.